Protein shakes can help on Ozempic, semaglutide, or Mounjaro, tirzepatide. But they can also make your stomach feel worse. The shortcut works only when the shake matches what these drugs changed. These drugs slow stomach emptying, so the wrong shake can sit heavy fast. If it is too heavy, too fast, or too sweet, it stops helping and starts triggering symptoms. A lot of people reach for a shake because eating feels harder and protein matters more. The problem is that many shakes were designed for bulking. They were not designed for this kind of stomach sensitivity. That is why one bottle can feel easy for one person and miserable for another. Volume, thickness, fat, sweetness, and drinking speed all matter. Those details often decide whether the shake helps or leaves you nauseated, bloated, or overly full for hours. I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. These drugs reduce appetite, but that is not the whole story. Food and liquid can sit there longer than people expect. A shake may look small. Your stomach still reacts to the same factors, including speed. A shake that looks light can still hit your stomach hard. Liquids usually leave the stomach faster than solids, so many assume a shake must be gentler. On these drugs, that shortcut can fail. A thick shake with fat, fiber, and intense sweetness can hit harder than expected. It may act less like a light drink and more like a rushed meal your stomach did not want. A light shake, sipped slowly, can reduce problems when solid food feels hard. A dense shake can do the opposite. That is especially true if you add it after a meal or use it while you already feel backed up. High protein does not mean easy to tolerate. Some shakes pack 20 or 30 grams of protein with lots of fat, thickening ingredients, sweeteners, or a very creamy texture. On these drugs, those details can turn mild stomach sensitivity into nausea, reflux, bloating, or diarrhea. Sugar alcohols are sweeteners that can make some people gassy or give them loose stool. Gums are texture builders, and some people simply do not tolerate them well. So a shake can look healthy on paper and still be the wrong product for your stomach right now. That is why people can try a shake that looks healthy and still feel worse. They often think protein itself is the problem on Ozempic or Mounjaro. In many cases, the problem is the form, the size, and the timing of the shake. If your goal is protecting muscle, this matters even more. Eating less can help weight come down. Eating too little protein makes it easier to lose lean mass, meaning muscle and other non-fat tissue. A bad shake choice can worsen stomach symptoms and make muscle loss easier at the same time. Some people run into trouble when shakes start replacing regular meals instead of fitting into a stable routine. They cannot finish meals, so they start sipping calories all day. That can help them get enough protein. It can also blur hunger, prolong fullness, worsen nausea, and hide which part of the day is really causing the problem. A shake can also hide the fact that your eating routine is still causing stomach problems. If breakfast is skipped, lunch is rushed, dinner is too large, and water is low, the shake may look like the fix. In reality, it may be helping the same eating routine continue. Then the drug gets all the blame, even though the eating routine is also causing part of the problem. The people who do better usually use a shake in a small amount and at a slow pace. They use it to replace a meal they cannot finish or to make protein easier to tolerate. Others use a shake only after meals go off track. They chase missed calories, drink too fast, and choose whatever tastes best. Then they expect the bottle to fix stomach problems caused by the way they are eating. Start smaller than you think you need. Half a serving often teaches you more than a full bottle. Choose lower fat when nausea or lingering fullness is the main issue. Choose a thinner shake when heavy texture has already been bothering you. Speed matters more than most people expect. Finishing a shake in 5 minutes can feel very different from spreading it across 20 or 30. Fast intake sends volume into the stomach before your body has time to adapt. Slow sipping is often the difference between a shake that actually helps and an afternoon of nausea or pressure. Timing matters too. A shake is usually better as a replacement for a meal you truly cannot eat. It is usually worse as an add-on after a meal that already made you too full. It also tends to work better during a calmer stomach window. Late at night, reflux and lingering fullness are easier to trigger. If a shake leaves you feeling okay, less hungry, and able to get enough protein without worsening symptoms, it is probably helping. If it repeatedly leads to nausea, bloating, reflux, cramping, or a heavy stuck feeling, stop calling it a healthy shortcut. It may simply be the wrong tool for your current dose, timing, or stomach tolerance. Ready-to-drink products are not always easier than homemade ones. A simple shake with fewer ingredients may be easier to read and easier to test. That makes it easier to tell which shake your stomach tolerated better. If you change the powder, the milk base, the sweetener, and the serving size together, testing gets messy. You will not know what caused the problem. Whey is a milk protein, and some people tolerate it well. Others may react more to lactose, the milk sugar, or to how heavy and creamy the rest of the shake feels. That is why protein shake is too broad to be useful. Two products with the same protein number can feel completely different once they hit your stomach. Temperature can matter too. Some people tolerate a cold shake better because it feels cleaner and less rich. Others do better with a less icy drink because it is easier to sip slowly. There is no perfect temperature for everyone. What matters is whether drinking shakes starts to feel more comfortable and predictable for you. If constipation is the main issue, more shake is not always the answer. If diarrhea is the problem, a sweetener-heavy shake may push things the wrong way. If reflux is the problem, volume may matter more than protein itself. Action should follow the symptom pattern, not the marketing claim on the container. That is why one shake can help one person and bother another. On Ozempic or Mounjaro, they work best when they are lighter, smaller, taken more slowly, and used on purpose. Used well, they help you get enough protein without worsening stomach symptoms. Choose a shake your stomach can handle now, not the kind you used before starting the medication. Medicine, simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.